Hi everybody, welcome to week 5 of Organizational Leadership and Informatics. I really appreciate the good discussion that we had last week about barriers involved in the legislative process and possible gender inequality. I think that while all of us didn't agree on all of the specific points, that everyone was able to get their point across in a respectful and professional manner. So nice job on looking at that. Just wanted to reiterate on participation. Some of you may see that some of the posts that you included for last week were not marked as substantive, and so you won't be getting participation points for those. I did mention, I think last week and the week before, that I was going to, now that you have gotten used to the online forum, to really hold you accountable for those requirements, that each substantive reply either had to have a reference to support the assertions that you were making, or had to be an in-depth discussion about a personal experience that backed up the assertions that you were making. So basically, I'm really trying to get you into the habit of providing evidence for claims that you make, okay? So if you had an issue with that this week, I'll certainly include it when I do your participation points and let you know about that. But just wanted to make you aware that's why some of your posts this week might not have been marked as substantive. Okay? All right, objectives for this week. Analyze how innovative models of care affect collaboration among advanced registered nurses and other stakeholders across the industry. Examine how innovative care models promote cost effectiveness and quality of patient care. Define accountable care organizations and their impact on patient outcomes and the cost effectiveness of healthcare. That's a mouthful. All right, so to start out with our first DQ, we're talking about innovative models of care. Lots to choose from. We've got ACOs, medical homes, nurse-managed clinics. They're kind of some of the broad ones. Some of the other a little bit narrowed but more specific innovative models of care maybe is an organization that uses nurse navigator positions. That's also another innovative model of care. So any of those that you choose, I'm really looking forward to seeing what you find and to hear about all the different models that you're going to be describing. So hopefully we can have some really good discussion about those. The next DQ talks about accountable care organizations. And I did want to tell you about an organization here in Utah that functions as an ACO. Now, we know that ACOs came about in response to Medicare. So when we're talking about accountable care organization, it's were they involved in the Medicare pilot project, and are they going to be accountable care organizations with Medicare beneficiaries? There is an organization called Intermountain Healthcare in Utah that is a very integrated model and functions as an ACO, but within their own patient population. Intermountain Healthcare has, I think, almost like 20 hospitals, numerous clinics, their own insurance company called Select Health that's owned by Intermountain Healthcare, broad nursing case management throughout all the different aspects. They have a home health agency. They have a high-level trauma center. They have a tertiary pediatric hospital. So very much an integrated health system. And now they're working more and more to try to work with their physician employees and partners, and in some cases nurse practitioners, on how to get everybody involved on the same page as far as incentives to keeping our patients healthy and keeping them out of the hospital, and more of a focus on preventative care, and definitely more of a focus on evidence-based practice. So this is an organization that functions as an ACO within their own insurance environment and has really done this to increase quality and to decrease the cost of healthcare. And I'm going to include a link in this week's post, just a little blurb from one of the healthcare online sources, kind of about why they're not, why they did not participate in the Medicare ACO pilot project, and some of the things that they're doing. So they have a very innovative model of care. And I'm wondering if any of you have seen this level of integration within your markets that you practice in, or if you have any organizations that truly are ACOs with Medicare and their pilot project and going forward. So that'll be some good discussion this week to have about that. And I think the more and more we look at the nurse practitioner role regarding ACOs, medical homes, certainly nurse managed clinics, certainly the APRN has a stepped up role, just like the Institute of Medicine tells us that we want these individuals, which will be you, to function at the highest level of their practice within their licensure. And I think going forward, there's going to be just some tremendous opportunities, because we know that nurse practitioners, APRNs, provide a very high quality of care in a cost-effective manner. One of those things brings us up to equal payment for equal care. Only one of the reasons that nurse practitioners provide cost-effective care is that they do get reimbursed very frequently at a lower rate than physicians for providing the same amount of care. But we also have to look at, if we took that away, we know that nurse practitioners are very holistically focused, really a lot of focus on prevention, healthy living. So I think there are also some other cost effectiveness benefits to using nurse practitioners, even if nurse practitioners do end up receiving equal pay for equal work. So it's kind of an interesting discussion when we're talking about accountable care organizations. All right, so lots to discuss this week. You do also have your CLC project that you'll be turning in this week. It looks like all of the groups have selected a topic of legislation, so that's great. If you have any questions or run into any bumps, again, please just send me a note in the individual forum. So this is another PowerPoint presentation with speaker notes attached to each slide. I would try hard to kind of have someone look across those speaker notes and those slides so that there's some uniformity, so it kind of flows. So it doesn't seem like there's, 4 or 5 different people have made the presentation, so that it flows well across the slides and across the speaker notes. All right, I'll be really looking forward to seeing those at the end of the week and to working with you more in the main forum. All right, I'll see you there.